What is mechanical thrombectomy procedure? Mechanical thrombectomy or short MT has come as a very major advance in treatment of stroke or paralytic attack. Just like in heart attack, cardiologist can go and open the heart blood vessel to reverse heart attack. We can do the same in paralytic attack. We go through leg blood vessel or arm blood vessel into the brain, and the clot which is blocking the brain blood vessel, we can take it out mechanically, which is known as mechanical thrombectomy procedure. If patient comes on time to the hospital, then a lot of brain part can be revived. We do advanced imaging to identify which patient has brain which can be revived, and then very quickly we can do this procedure, which is quite a safe procedure. The key is that the patient should come on time to hospital, and they should come to a hospital which has got neurointerventionist which can perform this thrombectomy procedure, and they are available around the clock. So one of the major changes in neurosciences have been that treatment of stroke has come in, and if patients come in time, we can actually reverse stroke in many such patients. So all of us should know how to identify stroke and where to go a stroke ready hospital where modern facilities are available to reverse stroke.